Welcome back to The Why. I'm Christina Muchler. Last week we talked about some doctors profiting from marketing opioid painkiller prescriptions and in general the role that the medical field can or does play in the opioid crisis. Well, earlier today I was reading a Princeton University study that found doctors who got their training from a lower ranked medical school wrote 3 times as many opioid prescriptions. That's in comparison to those who went to an Ivy League or another top school. The researchers looked at 2 billion opioid prescriptions written between 2006 and 2014 to come to that conclusion. And Express Scripts, that's the biggest prescription benefit company, says starting in September, it will be limiting the number of opioid drugs prescribed to first-time users. Of course, that's in an effort to kind of curb the opioid epidemic and control who's getting these prescriptions. But the American Medical Association is criticizing that move, saying those decisions should be left up to doctors and their patients. So where do doctors really stand in the middle of this health crisis? Dr. Buck Parker, an emergency and trauma surgeon from Utah, he was pretty candid in talking to me about how he says it all started and how he handles addiction issues with his patients today.
One of the big reasons we have this is something that's called unintended consequences. There was back in, and I don't know, you're probably familiar with this, but back in, I think it was 2002, or ish, we started, JACO started making these surveys of hospitals and seeing if patients are satisfied. So these satisfaction surveys, and these surveys turned out to be, the surveys turned out to be something else. They turned out to be a way to penalize hospitals and not pay them as much from the government. And then the hospitals figured out, oh, geez, if our patients aren't satisfied, then we're not going to get paid as much. But we know that patients, when they don't have pain, are more satisfied. So let's, kind of ramp it up and make sure everybody doesn't have pain, which is a good idea and it's a bad idea. Nobody wants our patients in pain, but on the other hand, we don't want them addicted for the rest of their life. So we didn't see this coming, and obviously everyone is acting out of goodwill, really, but that's really kind of what happened. It's, again, the hard decisions to make. And the hard decisions to make at this point are to say, hey, we really screwed up. We shouldn't have done this. Let's help, kind of thing. And let's build these programs for people to come in and get you clean. So I think when I tell that story, not very many people have heard that. And I think maybe everybody should. I would like to say that I'm handling it really well, but I've been kicked out of the room twice in the last couple months for trying to talk, be serious and talk straight to people. They don't want to hear it. I mean, this is how bad addiction is that you say I'm not addicted, and when somebody like me, I see it every day. It's obvious to me that you are, and I say, look, we'd really like to help you. Maybe we should think about tapering down. And I think maybe this the opioid is causing more problems than it's solving for you, and let's talk about this. And they say, some prevent and get out of my room. I don't ever want to see you again, doctor. Give me a new doctor, kind of thing. So I do try to be pretty straight with people and say, I think that this is complicating your current issues or whatever, and can I help you, or let's get you some help or something like that. I try and be very straight with people. Most people, they get it. They understand that I'm trying to help, and I think a lot of doctors are, and then some people don't. But again, it's not a quick fix, and even I mostly practice in the hospital, and I'm sometimes happy to see those people walk out of the hospital because I know it's a very long road to recovery.